Hi everyone! If you are on Medicare or you're helping a loved one navigate Medicare this year, you need to watch this video. Medicare Part D, which are your prescription drug plans, are seeing some big changes in 2026. And as we prepare for the AEP, October 15th to December 7th, it's very important that you stay up to date on these changes to select the best possible plan for your needs. So in today's video, we'll discuss some of those 2026 changes that could affect drug prices, premiums, and more. We'll also take a look at the plans that are currently available for 2026 on Medicare.gov and teach you how to navigate it. So stay tuned. So let's start with a quick refresher and give you the Medicare Part D basics. Now, if you're already a pro, you can check out the timestamps in the description below and feel free to jump ahead. So Medicare Part D are your prescription drug plans. Because remember, original Medicare doesn't really cover prescription drugs except for some very limited exceptions. These would be basically drugs that are administered by your doctor in some type of clinical or hospital setting. Things like chemotherapy, vaccinations, or even certain oral anti-cancer drugs. But for the most part, those regular medications that you take on a routine basis will not be covered by original Medicare. These would be things like medications for high blood pressure, cholesterol, or even antibiotics. So Medicare Part D works alongside original Medicare to cover your basic prescription needs. Now, Part D plans are offered by private carriers. However, they are federally regulated, so there are guidelines that they must all adhere to. So why is 2026 a big year for Medicare Part D? Well, this is really a year that we're seeing huge changes as a result of the Inflation Reduction Act. Under the Inflation Reduction Act, for the first time, the government was really able to negotiate certain drug prices directly with the makers. This resulted in severely discounted drug rates for some of the most expensive medications. For example,
Januvia, Fiasp, Farxiga, Enbrel, Jardiance, Stelara, Xarelto, Eliquis, Entresto, and Imbruvica.
So many seniors will see drastically reduced copays for these medications. However, in an effort to offset these costs, seniors may notice that their premiums have increased or other medications may have moved to different tiers, affecting their copays. And we'll talk more about those tiers later in the video. So let's discuss some of those key Part D changes for 2026. First, there's the change to the out-of-pocket maximum. Now, previously, there really wasn't an out-of-pocket maximum for Part D plans. There was the catastrophic coverage phase, and once you entered that phase, you would be responsible for a much lower copay, usually 5% of the drug's actual cost. But it didn't actually serve as a true out-of-pocket maximum, and seniors could still be on the hook for thousands of dollars if they had more expensive medications. Now, in recent years, Medicare has actually imposed a true out-of-pocket maximum, and in 2026, that out-of-pocket maximum will be $2,100. There's also the negotiated drug prices I just mentioned. For the first time ever, Medicare was able to negotiate drug prices directly with the manufacturers for some of the most expensive medications that don't offer generics. And as the years continue, it's expected that they're going to add more and more drugs to this list. There's also coverage gap changes. Luckily, the coverage gap or donut hole is gone. In years past, Medicare Part D really was very confusing and difficult to understand with these stages of Medicare Part D: the deductible, the initial coverage phase, the coverage gap, and catastrophic coverage. When moving from the initial coverage phase to the coverage gap, seniors would notice that their copays would really skyrocket once they had met that financial threshold. This coverage gap is now gone, so seniors move basically directly from the deductible, the amount that you have to meet out of pocket before your coverage begins to kick in, the initial coverage phase, during which your copay is determined by a tier of the medication, and then moving straight on to catastrophic coverage, which is really just an out-of-pocket maximum at this point. So these are all great things, but how are these affecting those monthly premiums? Well, you can expect to see a difference in your monthly premium this year as insurance carriers are looking to offset some of these costs. But your monthly premium is not the only thing that I want you to review when determining which plan is right for your needs. There are several other factors you need to take into consideration. First, check your current medications. This is absolutely imperative. As you'll see in a moment when we check out Medicare.gov, when previewing Part D plans, it will ask you if you want to compare costs of your medications. And you absolutely do. It's very important that you compare not only your monthly premiums, but the copays of the medications that you take. This is why it's important to understand the plan's formulary. The formulary is just a fancy word for the list of medications that your plan will cover. Now, medications may have changed tiers on your plan's formulary, which could affect their copays. And review pharmacy networks. So Part D plans do have pharmacies that are in-network versus pharmacies that are out-of-network. And you may notice a drastic change in the cost of your medication based on whether your pharmacy is in-network or out-of-network. Now, in all honesty, this is probably not the most important deciding factor when making a decision regarding your Part D plan, unless you live in a very rural area with limited access to a tremendous amount of pharmacies. But it is important to know which pharmacies are in-network versus out-of-network when filling your medication. And you can also opt for a mail-order pharmacy, which may be less expensive as well. Now I want to give you a brief rundown on the tiers of medications. These can be a little bit confusing to understand because they don't work in a uniform way. Some plans could have as little as 4 tiers, while some may have as many as 6. So there are some general rules that they follow, but it's not exactly the same. So you do need to understand that when comparing plans, which we will do in just a moment. But before we do, a brief pause to remind you to please like this video and subscribe to stay up to date. There are constant changes coming to Medicare, so it's more important than ever that you stay up to date. Also, if you have any questions about your Medicare coverage or health insurance in general, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers. We're licensed nationwide and there's no charge for our services. So if you have questions or you would like assistance enrolling in a Part D plan or any type of health insurance, feel free to reach out and we are more than happy to help. All right, let's get back to it. So usually with the tiers of Part D plans, the lower the tier, the less expensive the medication. Often it breaks down that Tier 1 would be preferred generic, Tier 2 would be non-preferred generic, Tier 3 would be preferred brand, Tier 4 would be non-preferred brand, and Tier 5 would be specialty medications, meaning the most expensive. However, as I said, that's not always the way it breaks down. Sometimes when there are 6 tiers, that 6th tier is actually really the most basic generic medications, and those end up being your less expensive medications. We're going to see that when we check out Medicare.gov right now.
So here we are on Medicare.gov. Just scroll down to where it says Find Health and Drug Plans, and it will ask you to put in your zip code. We've selected 2026 because we are currently previewing plans. Although it's not open enrollment just yet, you won't be able to enroll in the plans until October 15th. At this point, at the very least, you can preview the plans to try to narrow down which options might be best for you. Now, here you're going to select Medicare Part D. Of course, if you were interested in a Medicare Advantage plan, you would select that, or a Medigap plan, which is also known as a Medicare Supplement plan, you would click that. But today we're just talking about Part D plans. Now it's going to ask if you get help with your Medicare health or drugs. So if you have Medicaid, if you have supplemental security income, a Medicare savings program, or if you are eligible for extra help with the drug costs. We're going to put, I don't get help from any of these programs. Do you want to see your drug costs when you compare plans? Absolutely. That is so very important. So you need to know what medications you take and the dosages. So let's put in some of the more common ones. I'm going to put in Lipitor. I'm going to leave it as a brand name just so that you can see the difference in costs. So we'll keep the brand name. Add to my drug list. Let's add another drug. Add that one for blood pressure. Pretty common medications. Okay, so we've got one brand name, one generic. That should at least help us to compare. Done adding drugs. Now we should put in, well, we already put in a zip code, so it's going to ask you to put in some pharmacies. I highly recommend that you select one mail order pharmacy and then some of the other pharmacies that are nearby. I don't know what some of these are. They're not big brand names. So let's see. We have a Walgreens, a Harris Teeter, Hawthorne, no idea what that is, CVS. That should give us enough information, I think. All right, so right now it is sorting by lowest drug plus premium cost. Now, I am expecting that because I put in a brand, and it's usually a more expensive brand name medication, that I'm going to see some high costs. Yeah. So this is all due to the Lipitor, I guarantee you. And you will see very often there's a difference in retail pharmacy versus mail order pharmacy. Usually the mail order pharmacy is less expensive. That's not always the case, but usually. And in this case, it's really just a couple of dollars. So it's going to boil down to what is more convenient for you. But right now it is filtering or sorting rather by lowest drug plus premium cost. You could filter just by lowest monthly premium if you want. And you could also filter by drug. So the deductible for 2026 is $615. Now, that is the maximum deductible that any plan can charge. Plans can offer a lower deductible to entice beneficiaries, but the most it could be is $615. We're going to go back to lowest drug plus premium cost. It's just a more efficient way of sorting. So let's take a look. I'm already noticing some changes from last year because if I recall, when I put in the zip code last year, there was a monthly premium with $0. So we're already seeing a $3.60 increase. Not that that is a huge increase, but just something you should be aware of. So let's compare some of these plans. So this one is currently saying that this is basically it's going to give us the best bang for our buck based on the information that we have currently put in. So let's add this one to compare. You can compare up to 3 plans. You'll also notice here that 4 of the 4 selected pharmacies that I chose, plus of course the mail order pharmacy, are covered in this plan. There's also the drugs and their costs. You'll see right now, this is what I'm talking about. Let me just scroll down here. Yeah, so one medication, no copay, and the other is pretty much the entirety of the yearly costs. Now, here's the real problem. Lipitor is not covered by this plan's formulary. So that means that out-of-pocket maximum does not apply. I'm going to click back real quick because basically if it is currently sorting by lowest drug plus premium cost, that means that none of these plans are going to cover Lipitor. Oh, that is a shame. Let's go back. I want to change one of the pharmacies then, and maybe I'll add another drug. I'm going to change one of these pharmacies just so that you can see the difference in costs when a pharmacy is in-network versus out-of-network. Okay, let's try this My Clinic. Maybe that is obscure enough. Here we go. Okay, so now 3 of 4 are in-network. So that should at least give us a better indication when we're comparing. So we're already comparing this one. Let's find another plan that we want to compare. Let's try this one. And let's find a plan that has a lower deductible as well. Okay, that should give us enough. Then we click compare. Here we go. So the star ratings aren't available because we're not in open enrollment yet. This is the total monthly premiums. We've got one for $3.60, one for $32, one for $110.90. Now I can already say that based on the information that we have currently put in, this would probably be the best plan for our needs. It's not always the case that the least expensive plan is, of course, the best, or that the most expensive plan is the best. It depends upon the medications that you are taking. And our issue here really is that the Lipitor isn't covered by any of these plans. You can see what the tremendous cost difference is between a generic medication and a brand medication, especially if it's one that's not covered. Now, if this were the case, if you are someone that needs to take the brand medication, and I do know people that say that certain medications, the generic doesn't work for them, they have to take the brand. There are other options for you. For example, you may want to look into GoodRx and see if there are coupons offered for that medication. And you can even look into state pharmaceutical programs or pharmaceutical assistance programs to see if there are any additional discounts available for that medication. And I would highly encourage you to do so because as you can see, if you were someone who had to take Lipitor, brand name Lipitor, it's really expensive to have to take this and there's no coverage available to you. So now let's look at in-network versus out-of-network. So in-network with this plan, your total drug and premium costs for 2026 based on what we put in for in-network would be $5,814 at a preferred pharmacy, or maybe $5,808 at a mail order pharmacy. Now, if you were to go out of network, it would be $6,092.28 at one of these out of network pharmacies. That's really because one of the medications are covered and that high blood pressure medication is an inexpensive medication. So you're really just having to pay for that out of pocket at this out-of-network pharmacy. But if we put in different medications, then you'd probably see a greater difference. I also want to look at the plan details here. So let's scroll down. Here's your monthly premium, your deductible. Here's your medications that you listed, the pharmacies that you listed. Here are the costs at each of these pharmacies for each of these medications. So $0, $0, $17 for some reason, and $0. That's because this one is in-network, but these are in-network preferred. So in-network preferred will give you a better rate usually. And then there's this out-of-network pharmacy. The big culprit, as I mentioned, Lipitor. Wow, that's expensive. Let's scroll down. You won't meet your deductible because the high blood pressure medication is $0, so that is not counting towards your deductible, and the Lipitor isn't covered, so that's not counting towards your deductible because the money that you pay towards your deductible, only covered in-network medications would apply. Then it breaks it down by month, what your spending would be. It'll do estimated drug prices at these particular pharmacies, view more drug coverage. So here are the tiers for this plan. This is not related to the specific information that we put in. This is just the general information of this plan. This plan is one of those that has 6 tiers. Okay. So now that Part D has been simplified, it's only really going to show you 2 columns here. The deductible, you pay the full cost. Once you're in the initial coverage phase, you have a copay or a coinsurance. So for this plan, for preferred generic, it's $0, generic $3, preferred brand 25%, and that's already starting to get very pricey, I assure you. Non-preferred 40%, very expensive, 25% for specialty tier, and for select care drugs, those are some of those. They just have a list of drugs that they'll say are select care drugs that are some of the most common drugs, an $11 copay. There's no more coverage gap, no more donut hole. Once you spend, Medicare is keeping track of your spending. Once you reach $2,100, you would enter into the catastrophic coverage phase. And for any drug that is part of your plan's formulary, and that's the key here, there's no more copay because it's now treated as an out-of-pocket maximum. Okay, I've removed the Lipitor. I want to add a different, also common medication. I'm going to keep the brand, and let's see if this one is covered. All right, so now we see that the Synthroid is actually a covered medication. So you can get a better idea of what it looks like when you have a covered brand name medication versus a generic. So our spendings have gone down significantly. And if you look here, right, so basically, I mean, our blood pressure medication is still at no cost to us. And this would be the copay at these specific pharmacies. Now, we still won't meet our out-of-pocket maximum. And now let's take a look. I wonder if this has changed anything. We're going to sort by lowest drug and premium cost. Oh, it still looks like this is still the best plan for us. However, by entering that information, it could have changed and made another plan that had perhaps a slightly higher monthly premium. It could have ended up lowering our yearly spending if the copay for that specific drug was significantly less expensive.
So remember, review your plan every year because plan options may have changed and costs may have changed. There may now be a better plan available for your specific needs. Also, make sure to keep an eye on your formulary, make sure that your medications are still covered, and make sure that the medications that you take have not changed tiers and costs unexpectedly. Of course, we highly recommend that you work with a broker. Brokers serve as a liaison between you and the insurance carrier, making the enrollment process just much, much smoother. If you'd like our assistance, you can reach us in the comments below or at the number on the screen. We are licensed nationwide and there's no charge for our services. Also, feel free to subscribe to stay up to date, and please make sure to like this video so we can get this information out there. If you've got questions about Medicare, I will put our All About Medicare playlist in the end screen below, and also you can check out this video to learn a little bit more about Part D. Thanks so much, and we'll see you next time. Bye-bye.